Okay, so today I talk about two things. So the first one is from one single CT, right? And CT is one of the most common imaging modality. And if you go to hospital, sometimes you get a CT. And I talk about around about 10 key findings, and the AI system can help to find, which is like a very critical findings for patients, but it's not very easy for human to do. I mean, for human doctor to do. And so in this way, we can compute a lot of clinical findings and very important clinical factors for a patient, and with some including 4 types of major cancers and 6 types of major chronic disease. And also the second part is talking about the precision medicine for cancer treatment. So one of the most deadly cancer is pancreatic cancer. So pancreatic cancer right now has no way or no clinical means to find early pancreatic cancer smaller than 2 centimeter or 1.5 centimeters. And this is the work we published about a year and a half ago. And right now has been used in China and many elsewhere for more than 500,000 patients. And so this is the only known clinical means for finding early pancreatic cancer. So pancreatic cancer has only around 10% 5-year survival rate. So there are some images here, but I don't think I have time to discuss about a lot of in details, right? And so this is the work was listed around the major AI breakthroughs was listed at Stanford AI 100 Index 2024 last year. And of course, from chest CT, and you don't only look at pancreatic cancer, you also can look at liver cancer. So liver cancer is very common, but for people about 50 years old, actually 15% of the people has a liver tumor. Liver tumor not necessarily means benign, not necessarily means malignant. Most of them are benign. So we have a system so we can have very high accuracy about detecting liver tumors, but we also do the initial diagnosis and tell people whether this is a benign tumor or this is a malignant tumor or one of the 7 types of the tumor. Because for tumor management, it's not only finding a finding, but also give patients initial diagnosis. If they are benign tumor and a malignant tumor, for the patients, it make a completely different story. So the accuracy is about everything. So also after a patient has a initial tumor, the next step is really for differential diagnosis and for confirmation. So we have another AI system, and we'll do a differential diagnosis into classifying a tumor into 7 types. So because each type has different clinical meanings, we'll have different clinical follow-ups. Some tumor may be totally benign. There's nothing you need to do. But for some tumor like HCT, ICT, there's something you have to do immediately. And of course, up to 20 to 30% of people have lung nodules. Lung nodules are mostly benign. So the key things is about identify which lung nodules will become malignant and which one will become benign. So this is actually a very difficult problem even for human readers. So most of the thing I talk about here is they are relatively difficult for human readers. I mean for human physicians. So we have an AI system. It's not about replacing a doctor's job, but more like a companion or more like a co-pilot together with a physician, together to finding the most critical clinical demanding findings at the same time with very high reliability and quality. And also another thing is not how many people look at it is actually 1/9 of the work in the clinical workflow in radiology is about chest wall. So for women, the chest wall means like it can easily missing breast tumors. So breast tumor typically will do like a mammo or MRI or ultrasound. CT, you can see breast tumors, but it's not common. But in the current workflow, you still are responsible for detecting the breast tumors, even in CT. Even it's not a conventional way about doing tumor or cancer screening, but it's still important, required by law. So the physicians or radiologists are required to finding those lesions, even they are not in the conventional imaging modality. It's still required to find this. So AI can fill the gap and do something which human cannot do easily. Another thing is not just about cancers and tumor. Not many people know lymph node. We have one of the system which can mapping the malignant lymph nodes or enlarged lymph node station lymph nodes for a human body. So I'm mostly like oncology imaging, but lymph node, cancer. Another name of cancer is called incurable inflammation. So the volume of enlarged lymph node for a person representing the amount of inflammation inside the human body. And this is a known hypothesis. If a person has a lot of inflammations, it means like this person is weak. This person is prone to cancer, other things. But until now, there's no way you can compute these inflammations. And you have to be able to really mapping the enlarged lymph node or abnormal lymph node within the human body. So this is another many AI subsystem which does that. And just show you more images and picture how you compute that. But this is a very difficult problem. We're working on that for many, many years. And I think right now we have a kind of a product prototype already somewhere in Alibaba Cloud. You can try to use it, right? And another thing is also from ACT. You can measure or you can access the major cardiovascular major event. And this is something not human can do at all. So we can have a guess, but this is something not human being can do, not a human reader can do. So the AI is mostly doing something which is helpful or necessary for the patients, but it's hard for physicians to compute. So it's like a complementary companion in the sense. It's still a very important task. CVD is still the #1 killer worldwide. I do not have time to go into the details, but I just show you a lot of pictures and also with the reference. Yeah. So, and also we are trying to analyze the underlying cause of CVD because there are up to 14 different kind of causes. Why you need to know the cause is, it's not just about finding this risk. It's about managing those risks. If we know the underlying cause, it's just we have a better way, a better shot to maintain or to control or to delay the progression of the underlying risk. The beauty about working on medical imaging and other things, you can see a lot of pictures, right? And another thing, and this is mostly not for conventional radiology, it's more like for emergency departments, it's from CTs, you can see AS, acute aortic syndrome, which is a very deadly disease. It happens rapidly. And this is where we fit into the clinical workflow very well. So it's it's already in a prospective trial in China, in Shanghai, and in Hangzhou. And we kind of have around 15 to 20 beneficiaries every month. So their admission to confirmation time is within 2 hours. Yeah. Another thing is PE is a relatively similar story. So we have publication reference underlying clinical trials. And of course, liver is a big thing. In Hong Kong, in Southern Chinese, and liver disease is a continuous spectrum. from like a steatosis to cirrhosis and even like into like early liver tumors. Yeah. So for the liver steatosis is like we compare with the current gold standard, and we are very close to the accuracy of gold standard. One of the thing is it's very prevalent is about osteoporosis. So the AI actually can compute osteoporosis score for each of the vertebra, which is not possible for human readers. So basically, here I talk about the thing is AI. I have a group of AI working under the scene as a radiologist or oncologist companion, which can detect about this 9 or 10 very important critical findings. Each one of them can be deadly, and altogether, it can like assure many important clinical findings can be detected early, can be diagnosed accurately. Another thing is like in the real practice is like people often do low-dose CT. So the low-dose CT, the image will be very noisy, right? One thing is we do is not we trying to improve the explainability and the usability for the physicians. It's not AI give you a score or tell people what's what, what kind of diagnosis or disease. It's very important for physicians. They can confirm that. They can verify that, right? So we also improve the experience how they can do that. And so we kind of like improve the quality of the image. So this is the raw image you will get from the CT scanner, and this is after this is after the AI algorithms which will denoising. So not only we working on things, funding things, we also will make picture looks nicer, and so for human readers, it's easier for them to do the confirmation. This is something like this is I think this is pancreatic cancer, right? This is a pancreatic cancer. So we can improve the detection performance and at the same time improve the imaging quality. So it's making it easier for human readers to confirm the disease. And this is something like also for liver steatosis or fatty liver grading. It's also like after we do the denoising, the accuracy will be on par with the regular dose. We want to decrease the dose, and the image also looks prettier, and with higher fidelity. Yeah. It's a lot of plots. It's finally, there's one thing called BCI, and it's called the Body Compositional Index. So this is a very new topic in US. I'm based in US. I'm leading the global R&D at Alibaba. It's about you want to know basically the health conditions of a human. No matter it's a regular human or it's an oncology patient, right? You want to know, and you have a way to measure the general health condition. Let's say you can map all the lymph node stations. So basically, you can map the inflammation status or amount in this quantitatively about the patient. And another thing is if you can segment the CT images into 200 plus organs and anatomies, right? You can measure the volume. You can measure like the fat infiltrations within the human body, and you can measure where the fat are distributed. One thing bothers our aging society is about obesity, right? Obesity was normally measured by BMI. The BMI is a very bad, inaccurate markers, right? So, Linson just published a paper, 40 pages, about how you define what's clinical obesity, right? What's clinical obesity? In my understanding, I'm not a doctor, but I'm working with physicians for nearly 20 years. I think it's about maybe how the fat distributed between organs and within organs, right? And many other things like the fat we have fat distributed in many different places, but we could not measure it. And also, if we can compute we can segment most of the organs, and we can compute the fat concentration within each organ, at least within the major organs. We all know if the heart has a lot of fat, it increases the risk about a major cardiovascular event, right? So this, when you have like more than 250 structure you can segment, this is the imaging will become from a voxel to be like a semantic aware or organ aware space. So once you have the segmentations within organ, you can compute a lot of markers that will help you understand the general condition, health condition, quantitative about the patient. The many other things you can compute, in this kind of profession, you have to compute a lot of numbers and do a lot of comparison and a lot of pictures. Yeah. So I show you one example. We use this. It's already a product. It's already on the Alibaba cloud somewhere. It also, in the past few days, we have exciting discussions with local providers in Hong Kong. This is just as we discussed about measure the quality of the muscle. So for oncology patient or a regular patient, we will have a lot of muscle, not just the muscle volume, but the quality of the muscle. Means there's less fat in the muscle, and you have a lot of muscle. And for this type of patient, you can survive longer. And if this patient is an oncology patient, you can give them a higher dose of like chemotherapy or radiation therapy. You can give them a higher dose. So because they have higher endurance, so they can kill the cancer cells. Like they can endure like a more higher dose to kill more cancer cells. And this is one example of many things you can do. So this is actually, unfortunately, a disease. There's no cure. So whether the patient can survive or not, and their muscle quality play a major role. So you can see is from this picture. So when you have the muscle quality measurement computed in as a independent center, as an independent statistical random variable integrated into the regression function, into the risk factor, it does a better job in terms of predicting who will be surviving, who will be not. This is one part of the thing is very oncology related. So you probably heard of IBM Watson a long while ago. I think they are solving the right problem, just they don't have the right solution. So for I'm mostly like a cancer imaging or oncology. So oncology, for certain things, you have three things to measure, especially two things. When the patient has been diagnosed with the tumor or cancer, the first thing you want to do is the cancer staging, the tumor staging, T1 until T4. But this is not an easy thing to do accurately, right? So we have AI system can do for head and neck cancer for the T staging. It's a complicated learning system with many things embedded. But we hope we have an AI system can automate the process about T stage estimation, and this can be used in the real clinical practice. And another thing is end staging. I know a lot of people, you're probably not a physician. And for cancer treatment, the next important thing is whether the cancer already escaped to the lymph node station nearby. And this is a very daunting task, not very easy for human to do. And this is another, like for esophageal cancer, it's a similar thing. I give you a reference here. End staging for esophageal cancer. T staging for liver cancer, for lung cancer, and N staging for lung cancer. Yeah. So that's basically that's what it is. So I think very important things no matter you do something or not, right? I think make sure really the patient can be benefited. I think most of the AI we talk about for convenience and efficiency. In my opinion, the most important thing is the quality of the healthcare. The really AI should make a better quality healthcare, and we make it. Then the next step is make it very accessible. So everyone, you have a cloud computing, you have computers, and you can get very high quality clinical methods by computing. Also, the R&D cost is expensive, but after you have done that and apply this, the age cost is relatively very cheap because it's just burn like electricity and the GPUs, right? So that's basically my talk, and yeah, I think thanks for your attention. Yeah, thank you.